Hi guys, today I'm going to be presenting to you about mononucleosis. So what exactly is mononucleosis? Well, commonly referred to as mono, the disease is really just a group of symptoms caused by the Epstein-Barr virus, also known as EBV. It's also more commonly referred to as the kissing disease, mostly because it is transmitted via saliva. And anyone past the age of 1 can be infected with EBV, but it typically tends to be more common in adolescents or young adults. So there are several risk factors for mononucleosis. Like I said, children can be infected with mono, or infected with EBV and get mono, but it's typically common in that adolescent to young adult age range, so from ages 15 to 30. It's again more common in people who tend to be in larger groups, so students in high school and college. Also healthcare workers who come into close contact with those infected patients. So for example, like medical interns, nurses, caregivers, and such. Lastly, if a patient is on immunosuppressant drugs or meds that compromise their immune system, then that is also a risk factor for getting infected with mono. So how is mono transmitted? Like I was saying, it's usually through direct contact with the bodily fluids of an infected person. This usually happens through kissing or sharing utensils or food with someone who's infected, so through saliva. But transmission can also occur through blood transfusions, sexual contact, organ transplantation, really anything, any kind of process in which bodily fluids are exchanged between an infected person and someone who is not carrying the virus. The incubation period for this virus is typically somewhere between 4 to 6 weeks. Children, like I was saying earlier, can also be infected, but because they're usually asymptomatic, it's harder to tell. They can also pass on the infection, but it's usually through coughing or sneezing. Even though airborne transmission isn't a main tenet of this disease, that is, very rarely also possible for any infected person to pass on the virus to maybe coughing or sneezing because they're spraying that saliva onto somebody who's not infected. So what kind of symptoms do people with mono experience? So somebody with mono can experience all of the above. For example, they could have, somewhere between a mild fever to something more serious like a high-grade fever. They could be experiencing extreme fatigue or tiredness, lethargy, malaise, muscle weakness, aches all over their body, headaches, abdominal pain due to a swollen liver or spleen, or maybe even both. Enlargement of the tonsils or lymph nodes, sore throat, which may be misdiagnosed as a strep throat. There's a lot that could happen. There's a lot that's going on here. There's also, rashes that could develop on the body. Basically so much can happen, and there are so many different symptoms for mono that it may be hard to diagnose it at first. But typically that enlargement of the lymph nodes or tonsils, and those like white patches that you see inside the mouth and on the skin are hallmark symptoms of mono that help it to be more easily diagnosed. So to diagnose mono, your PCP may go through several different steps. The first one would obviously be that initial exam. Your doctor is looking for what age range you fall within. If you're in that 15 to 30-year-old high-risk category, then you're more likely to have mono than if you were any other age. They're also going to be looking for more like visible signs, like do you have enlarged or swollen lymph nodes? They're going to be checking for whether you're the upper left corner of your stomach, like does it look like there's a protrusion? Do you appear to have a swollen spleen, or liver, that kind of thing. After that initial exam, though, during that exam, they're going to try to rule out the effect of other possible viruses like Hep A and such. But after that initial exam, they're going to move on to lab tests. Usually lab tests aren't required because infectious mono is pretty easy to diagnose. But patients who have infectious mono with atypical symptoms require that further degree of testing. So lab tests include taking your complete blood count to see how much of those blood cells that you have. Do you show atypical or abnormal numbers? For example, with an infection, any infection really, your immune system produces a high number of white blood cells or lymphocytes in reaction to that infection to fight off that invader or pathogen. So you're going to see high levels of lymphocytes. Then there's also the monospot test. In this test, the doctor's looking for high numbers of this specific antibody called the heterophile antibody that the body usually produces in response to specifically the EBV pathogen. Then there's also the EBV antibody test, in which they're looking for just EBV antibodies, which also only are produced in response to the Epstein-Barr virus. So within the steps of diagnosis, your physician isn't just going to be looking for the levels of the blood cells that you have. They're also going to be looking more specifically for how those blood cells look. For example, whether your lymphocytes or white blood cells look atypical, kind of like this magnified image over here. That is one of the primary things that they're going to be looking for. So what exactly is the treatment for mono? Unfortunately, there is no specific treatment. Doctors would just recommend that patients follow through with home remedies like staying at home and resting for about 1 to 2 weeks to just relieve overall pain and body aches. More specifically, they could use ice packs or heating pads for that. Taking fever-reducing medication or over-the-counter painkillers like Tylenol for fever and pain, and also like non-steroidal anti-inflammatory drugs to relieve, again, that inflammation. Also, eating lots of anti-inflammatory foods like leafy greens, apples, brown rice, salmon, anything that is rich in antioxidants. Staying hydrated, drinking lots of water and warm beverages, anything that could relieve that discomfort or pain within the throat area. Foods that are easy to swallow and go down, like soups or broths. Gargling with warm water, more like warm salt water to relieve discomfort, again, within those swollen tonsils. So those are just examples of at-home remedies that could be done to treat mono on your own, because really there are no specific treatments. It's just it's a disease that usually goes away on its own. Most of the symptoms, at least the milder ones, go away within 1 to 2 weeks. Rarely, though, the more severe symptoms like that enlargement of the spleen or liver can last for somewhere between weeks to months. Doctors would also recommend that you stay away from contact sports because your spleen is enlarged. Or if your spleen is enlarged, then you should stay away from contact sports because doing anything too physical can rupture your spleen, and that can cause further complications that should most definitely be avoided. And these are the 3 primary sources that I used for my presentation. Thank you very much for watching and listening.